السلام عليكم. هذه المحاضرة مقدمة لطلبة الصف الثالث كلية طب الكندي جامعة بغداد. المحاضرة هي جزء من متطلبات موديول Renal Module. عنوان المحاضرة هو Anatomy of the urinary bladder and prostate. يقدمها دكتور حارث محمد، اختصاص الجراحة البولية. Starting with the urinary bladder. The urinary bladder is a reservoir، خزان. هذا الخزان الشكل مالته والحجم، its size, shape, position and relations all vary according to its contents and the state of the neighboring viscera. يختلف حجمه وشكله حسب الكمية المخزونة به. Its maximum capacity is about 500 ml. The empty bladder in adult have the shape of tetrahedral pyramid، هرم رباعي الأركان. هذا الهرم إلى 4 سطوح، سطح superior surface و 2 inferolateral surface، هذا واحد surfaces، هذا واحد السيرفس المقابلة and a base. In addition to an apex مال الهرم، وأكو هنا عندنا المكان للبلادر نيك اللي يدخل للبروستيت. The bladder in adults is entirely a pelvic organ, but it distends and expands into the abdominal cavity as it fills. In young children, the empty bladder projects above the pelvic inlet. عادة بالadults البلادر صايرة inside the pelvis، بس بالpediatric age group in children تكون طالعة برا البلفس حتى وهي empty، بس من يزيد النمو as the body grows the bladder sinks into the pelvis and take up its adult position. An empty bladder has the shape of tetrahedral pyramid at base, apex, neck, superior and 2 inferolateral surfaces. هسه راح نبدي نحكي عن relations of the bladder. احنا قلنا انه هذا superior surface، هذا inferolateral surface، اكو مقابله inferolateral surface ثاني، هذه البيز of the bladder and this is the bladder neck. الابيكس of the bladder اللي هي هذه الابيكس of the bladder points upward anteriorly and lies behind the upper margin of the symphysis pubis. It is connected to the umbilicus by the median umbilical ligament. هذا median umbilical ligament. The base or the posterior surface of the bladder اللي هي هذه faces posterior inferiorly. This is the base of the bladder. It faces posterior inferiorly and is triangular in shape. It is superolateral angles are joined by the ureters, and the inferior angle give rise to the urethra. In males, the two vasa differentia lies side by side، اللي هن ذني الفازا differentia lies side by side on the base of the bladder and separated by the seminal vesicles on both sides from each other. The upper part of the posterior surface of the bladder is covered of the base of the bladder is covered by peritoneum اللي هو هذا المكان. which forms the anterior wall of a rectovesical pouch. The lower part of the posterior surface is separated from the rectum by the vasa differentia, the seminal vesicles, and هذا المكان اللي هو البيز, separated by the vasa differentia and by the seminal vesicles and by the rectovesical fascia, which is termed as the denonvillar fascia. And this is the denonvillar fascia or rectovesical fascia. In female, the base of the bladder is closely related to the anterior vaginal wall. This is the anterior vaginal wall, and this is the base of the bladder. The superior surface of the bladder is covered by, this is the superior surface of the bladder. It is covered by a peritoneum and is related to the coils of ileum and sigmoid colon. And along the lateral margin of this surface, the peritoneum passes to the lateral pelvic walls, and as the bladder fills, it becomes ovoid in shape. This is the lateral margin, and this is the fold of the peritoneum. As the bladder filled, هذا نشوفها من هي امتى تكون شكلها as tetrahedral pyramid. When it fills, it becomes more ovoid in shape. And the superior surface bulges upward into the abdominal cavity. The peritoneal covering are peeled. The peritoneal covering is peeled from off the lower part of the anterior abdominal wall, so that the bladder comes into direct contact with the anterior abdominal wall. تشوفون هنا من تصعد البلادر مو تصعد inside the peritoneum, it peels off the peritoneum, يعني تصعد تبقى متصلة بالانتيريال abdominal wall. لذلك من نريد نسوي puncture بالانتيريال abdominal wall when the bladder is distended, راح نكون مأمنين انه احنا ما راح نسوي piercing الجزء من البريتونيال cavity او البريتونيال contents. The inferolateral surfaces are related in front to the retropubic pad of fat and the pubic bones. Retroperitoneal pad of fat and the pubic bones. Here the smooth muscle fibers of the bladder are continuous with those of the prostate. The neck of the bladder is held in position by the puboprostatic ligament in male. These are called the pubocervical or pubovesical ligaments in female. These ligaments are thickenings of the endopelvic fascia. When the bladder is full, the posterior surface and the neck remains more or less unchanged in position, but the superior surface rises into the abdominal wall. Now, the next topic, we are going to talk about the ligaments of the bladder. These are condensations of pelvic fascia, anchors the bladder inferiorly to the pubis and lateral pelvic walls and the rectum. The first one of these is the pubovesical ligament. The pubovesical ligament is a condensation of endopelvic fascia. It is a stout band of fibromuscular tissue in both sexes. It extends from the bladder neck to the inferior aspect of the pubic bone. They are divided from the detrusor muscle, derived from the detrusor muscle, part of the detrusor operon. In female, they contribute to the superior extension of the pubo-urethral ligament. They constitute the superior extension of the pubo-urethral ligament. In male, the detrusor operon is described as an extension of the detrusor that extends over the anterior surface of the prostate. This is and condense distally and anteriorly to form the puboprostatic ligament. The pubovesical ligament lies on each side of the median plane, having a midline hiatus through which numerous small veins pass. This is a midline view. Now to the we are going to talk about the median umbilical ligament. اكو عندنا 3 ligaments that comes from the superior surface of the bladder. اكو بيهن واحد هو true ligament and 4 الحقيقة هن 5 ligaments, 1 true ligament and 4 false ligaments. The true ligament is the median umbilical ligament. This is the median umbilical ligament. It connects the apex of the bladder to the umbilicus. It is composed of longitudinal muscle fibers derived from the detrusor muscle and becomes more fibrous towards the umbilicus. It is usually maintains a lumen lined with epithelium which persists into adult life, but is only rarely complicated by urachal cyst or sinus or fistula or adenocarcinoma. بالembryonic life, this is a patent tract اسمها اليوريكاس. during the post-embryonic life, بالextra uterine life راح يتحول هذا إذا fibrous band يسموها الميديان umbilical ligament or remnant of the urachus. احيانا يبقى بها لومن من الامبريولوجيك لايف، واحيانا هذا اللومن يصير بكومبليكيشن مثل cyst, sinus or fistula. The false ligaments، هذا الترو ligament الوحيد من هذين الخمسه اللي هو remnant of the urachus or the median umbilical ligament. اكو بعد عندنا 2 medial اللي هن هذني هذا وهذا، ذني الميديال umbilical folds، واكو lateral umbilical folds اللي هو هذا واحد وهذا واحد. From the superior surface of the bladder, the peritoneum is carried off in a series of folds. These are the false ligaments of the bladder. Anteriorly, there are 5 folds. The median umbilical fold over the median umbilical ligament, and 2 medial umbilical folds over the obliterated umbilical arteries اللي هو هذا واحد ومقابله هذا الثاني، and 2 lateral umbilical folds over the inferior epigastric vessels. بقى اللي نشوفه هسه بالصورة إضافة إلى هذني هذا هو الفاز difference، وهذه هي الفولد مال الانجوينال ligaments، هذا وهذا المقابل. What about هسه هذا كله الحكي عن ال exterior relations مال البلادر. What about the interior of the bladder? Looking to the bladder from the inside, the mucous membrane of the greater part of the empty bladder is thrown into folds that disappear when the bladder is full. These are the folds. These will disappear when the bladder is full. The area of mucous membrane covering the internal surface of the bladder base, this is the bladder base and this is the opposing area to it, it is called the trigone. The trigone is bounded by the two ureteric orifices and the internal urethral meatus. Here the mucous membrane is always smooth even when the bladder is empty. بهذا المكان دائما المثانة يكون الميوكس membrane smooth حتى من تكون المثانة فارغة، لأنه الميوكس membrane adherent to the underlying muscular coat. Because the mucous membrane is firmly adherent to the underlying muscular coat, the superior angle of the trigone, the superior angle corresponds to the ureteric orifices and the inferior angle corresponds to the internal urethral orifice. The ureters pierces the bladder wall obliquely, and this provides a valve-like mechanism. يعني المدخل مال اليوريتر on the outside مو corresponding to the exactly to the مدخل to the entrance on the inside. اكو بينات المسافة اللي هو يمشيها inside the wall of the bladder حتى يسوي a valve-like action which prevents a reverse flow of urine towards the kidney when the bladder is full. The trigone is limited above by the muscular ridge which runs from the opening of one ureter to that of the other and is known as the interureteric ridge. This is the ridge, interureteric ridge. The uvula vesicae is a small elevation situated immediately behind the internal urethral meatus, which is produced by the underlying median lobe of the prostate in males. The muscular coat of the bladder, composed of smooth muscles and arranged as 3 layers of interlacing bundle known as detrusor muscles. At the neck of the bladder, the circular component of the muscle coat is thickened to form the sphincter vesicae. Now, about the blood supply of the bladder. The blood supply of the bladder is derived from the inferior vesical arteries, the superior and inferior vesical arteries, which are branches of the internal iliac arteries. The veins are from the vesical venous plexus that drains into the internal iliac vein, forms the vesical plexus that drains into the internal iliac veins. Lymphatic drainage goes to the internal and external iliac lymph nodes. The nerve supply of the bladder comes through the inferior hypogastric plexus. The sympathetic postganglionic fibers originate in the first and second lumbar ganglia and descends to the bladder via the hypogastric plexus. The sympathetic preganglionic fibers arise as the pelvic splanchnic nerves from the second and third and fourth sacral nerves. They pass through the inferior hypogastric plexus to reach the wall of the bladder where they synapse. يعني بالنسبة للنيرف سبلاي sympathetic اللي توصل للبلادر هي من ال L1 L2 المصدر مالتها وتجي post ganglionic fibers. السمباثيك الساينابس مالتها يصير باللمبر جانجليا. اما الباراسمباثيك فمن الاس 1 اس 2 3 4 ويوصل بري جانجليونيك والساينابس مالتها يصير بالوول اوف ذا bladder. Most of the sensory fibers arising in the bladder reach the central nervous system via the pelvic splanchnic nerves اللي هي S2 3 4. So afferent fibers travel with sympathetic nerves via the hypogastric plexus and enter the first and second lumbar segments of the spinal cord. The sympathetic nerves inhibit contraction of the detrusor muscle of the bladder wall and stimulate closure of the sphincter. مثل كل sympathetic nerve بالبادي. السمباثيتك وظيفته انه يسوي relaxation للريزيرفوار and contraction of the sphincter. في حين الباراسمباثيتك بالعكس stimulate contractions of the detrusor muscle of the bladder wall and inhibit action of the sphincter vesicae muscle. لهنا يخلص الجزء المتعلق بالبلادر. الجزء الثاني اللي متعلق بالبروستيت راح اشرحه بكونتينيوتي وحده ويا اليوريثرا. شكرا لكم لمتابعتكم، وتنتهي محاضرة البلادر لهذا اليوم، وشكرا جزيلا.